Okay, well, one of the things then you brought up is what about low iron? What about low iron? Low iron. It's a very common problem, especially or almost only in our female patients. So the guys can kind of go off to sleep on this one. You don't have to worry about it. Low iron is a problem because iron itself is difficult to digest and absorb. Iron, and the iron in the tablets that we get, is a lot like the rust that's on your bumper. And if you scrape that off and try and dissolve it by stirring it in water, you'd find that that rust is not very soluble. Because it's insoluble, it's hard to digest and absorb. And so when people get low iron, they often get prescriptions or recommendations from their doctor to take iron tablets, which is compacted, compressed pills of rust. And it doesn't work very well. On the other hand, there's an interesting finding, and that is that iron that's in meat tends to be better absorbed. And so what they found is, why don't we wrap a little iron molecule in something like hemoglobin so it's better absorbed? And so a bunch of scientists did that. They took iron, wrapped it in a protein molecule like hemoglobin, and it's much better absorbed. And they tested it on dialysis patients. The reason they tested it on dialysis patients is they were constantly having to infuse iron into dialysis patients because every 2 days they have to stick a needle in them, put the blood out through the pump, and they would lose some of it on the way back in. So they took people who were needing transfusions every 3 months, put them on the tablets, and they eliminated the need for transfusions in 90% of patients. So this new iron, called proferrin, P-R-O-F-E-R-R-I-N, very good. And so if you have a bit of that, you may need to educate your doctor and or his P or her PA that proferrin. Pardon me? Oh, okay. Thought you were angry about the proferrin. So proferrin is a hot new development. As I said earlier, it wasn't my idea. One of my patients from Michigan is an oncologist, a specialist in cancer, and so he pointed it out to me, and the research on it is really good. And our patients in particular, because of the bypass, need extra iron, and so I would talk to your doctor about it.
Can I ask you, can you talk about chewables versus just the regular vitamins?
Yeah. The big thing about vitamins is the iron. The other things in vitamins are really, really not very valuable, and the data doesn't show they help very much. So most of the content of a multivitamin is very iffy as far as whether it helps at all. In a chewable vitamin, to make rust palatable, they have to bind it. And that's really the only thing we really want in those vitamins. So a chewable vitamin either has very little iron in it, or iron that's bound so that's poorly absorbed. So we are not big fans of chewable vitamins.
So if you're taking the proferrin, is that what it's called?
Yeah.
You don't need to take a multivitamin? Is that what you're saying?
Well, the vitamin business is really complicated, and I'll give you a little scoop on that. Can we stop this and start a new one?